A very good afternoon to one and all. I'm Dr. Surya Singh, and I've done my master's from AB Shetty, Mangalore, and a fellowship after that in head and neck surgical oncology from Delhi. I'm currently practicing in Chandigarh, and I am from Chandigarh itself. So the topic given to me is challenges in 3 years of post graduation, and that's a topic very, very close to me as well. So because definitely there are a lot of challenges that you'll be facing, and it's not a bad thing. It's something that you probably utilize to grow out in life. And because post graduation is not just about education, it is much, much more. It's a life, it's a concept in its whole self. So basically, the moment you come from graduation into the post graduation, it'll be like a jump for you. So, like you come from 10th to 11th, it's a jump. Similarly, when you come from graduation to a post graduation, this will be a jump wherein you don't know where you're going. You'll feel as if you know, but then again there'll be a moment when you'll know that then when you'll feel then you that you know don't know about where you're going. So it's like you're jumping off a cliff. Now you go down, you don't know that there's a lift which is coming from there and which will get you up and will take you much higher up than this cliff where you were standing. So post graduation is exactly like that. So basically when this happens is you'll have to realize that it's not just one thing that you have to think about, it's a million things that you have to think about. It's a total different level of life, it's a total different level of profession and a personal development as well that you're going to be incorporating and thinking and dwelling upon. Because in life you face a lot of challenges, and similarly in post graduation also there'll be a lot of challenges. There are things that about what is expected and what is humanly possible. There are a lot of things which will be expected of you from your professors, from your colleagues, from your peers, from your parents, from everyone you probably know or possibly know during that point in time. And how much you can fulfill, how much you can keep everyone happy, and how much you can keep yourself happy is one of the most important things. Because PG is a totally professional mindset. It's in some undergraduate courses in some undergraduate colleges, you can get away with a few things of not being very, very professional, be it a dressing attire, be it the way you carry yourself, be it the way you look. So you can get away with a lot of things. Whereas in post graduation, everything that is expected of you is very, very professional. Right from the moment you are in the college till the moment you sleep at your place and come back again. Everything should be very professional as it can get, because that's building you for life. I remember I'll share a small incident with you. I remember that here during my undergraduation, I used to wear jeans, I used to wear t-shirt, and I used to go to college most of the days. And it wasn't ever stressed upon that I really need to kind of uh, go in formals. So I wasn't kind of introduced to the concept as well. Now, when I landed up down south in Navy Shetty, and the first day I went the same way in jeans and in a t-shirt, and because I didn't know that you really need to wear a shirt, you need to wear trousers, you need to go in a very, very formal attire. And then everyone was looking at me as if, they've seen an alien or something. And then all the staff members, one by one, called me to their staff room and they told me that, this is a professional college. You have to kind of wear formal clothes. So, right from the way you present yourself, right from the way you dress up, till the way, about the studies and everything which comes into place, it's about a professional environment. And for someone who doesn't know about it, it is a challenge. And it's a good challenge. It'll be a very, very beneficial thing for you in your life. Then coming to the department part per se, you'll probably need to kind of do night duties. Maxillofacial surgery entails a lot of night duties, and it goes on for nights on end. And there'll be times where you won't even get time to eat, where you won't even get time to sleep, and you have to kind of manage it in between night duties, daytime college, and between you getting 1 or 2 hours to go back to your room or house to change, freshen up, and come back. Because this is one of the biggest challenges and the biggest jump, like I said, because you've never done this before today, and now you are into that, and you have to do that, and there's no learning in it. You have already come into it, and you have to do it. So take it in stride, take it as a very, very good challenge that possibly, because that's possible, you can do it. Everyone does it, you will be able to do it. And there'll be emergency on calls, duties, um, you know difficulty there. You'll have a lot of difficulties in meeting with a lot of deadlines, because besides the duties and everything, there'll be a lot of department work as well, a lot of study work as well, which I'll come to later on in the presentation. So there'll be a lot of things which you'll have to deal with. So there will most probably be times wherein you possibly can't deal with it, you possibly cannot manage it, because it's a very, very big challenge to kind of fulfill the requirements. But that's okay. Be kind to yourself. You'll push through. You'll be able to do it. It's your PG. That's what you're learning about. And one thing, just remember in PG, because that you cannot get away with things very easily. So this is a point to ponder upon. There'll be a lot of times before in your life when you don't have much responsibilities. Definitely, we don't as kids, as even till graduation, we don't, if you're staying at home. So suddenly there'll be a lot of responsibilities for you to do, personal, professional, everything. And you will be responsible for all the actions that you take, be it regarding the patient, be it regarding your own personal life, be it regarding your behavior with your contemporaries and your professors. In everything, your reactions and reactions, you're responsible for that. And also, if you're not taking an initiative to kind of implement an action, to kind of do something, you'll be thought of as if you're, kind of escaping. So, so you cannot get away with things easily. You'll be rewarded less, but you'll be rewarded nicely. Everything will be seen, everything will be taken care of. And this will help you grow. I'm repeatedly saying it'll help you grow, because PG in its own self is a life for you. So, departments, there is, because us being in the maxillofacial fraternity, there is, we're in the middle bridge kind of a thing. We all know that. So there's a lack of awareness amongst the medical fraternity and amongst the dental fraternity. This is not putting down anyone at all. It is just a fact. I'm talking on the basis of facts. It's a realistic world we're living in, and you really need to face the realities. The medical fraternity, most of the times, will kind of, you'll feel that your contemporaries in the medical department are probably looking down upon you in certain situations. You'll feel the professors, or people are not giving you much importance, that you being a maxillofacial guy, they'll just consider you as a dental guy. But that's okay. We take it to heart. I took it to heart a lot, and we do it. But you need to realize that with passage of time, people understand. Your work speaks for you. So there'll be, like, I'll give you a very, very small example. If supposing a polytrauma case comes in the emergency, there's an orthopedic fracture and there's maxillofacial fracture, or let's say or an orthopedic laceration, uh, or laceration on the limbs or something like that, and a maxillofacial fracture. But the orthopedic guys want to make sure that that there's not there is a fracture, there's not a fracture. So they'll probably kind of think that their injury is more important and your fracture injury is less important. So there you need to weigh what is important, what is not important, and that you definitely get to know with time. So there are a lot of ifs and buts, there are a lot of permutation and combinations that you'll probably need to see. And even if you feel that someone is trying to put you down, that's okay. Take it in stride. Prove it with your work. Prove it 5 minutes down the line. Prove it one day later. Prove it 1 month later, but prove it. You'll be able to do it. Because this is one of the biggest challenges that I faced myself. To be kind of, there were a lot of times when you kind of feel left out. There were a lot of times when you feel that probably, I could have done much, much better had I known more. But that's okay. This is PG is just learning. You're just learning. you can learn for a lifetime. But this is just learning, so it's okay. You just started your learning. Then lack of awareness amongst the dental fraternity as well for certain very minute things. They won't know that the patient, they can refer you the patient for certain things. And this thing amongst the medical fraternity and amongst the dental fraternity, the awareness, this is not just limited to your PG. This is limited for life. The place when you come out of PG and where you practice, the place there, you need to get referrals, you need to get patients. And for that, people need to know what you do. For example, I had my thesis on TMJR through synthesis, and there was a lot of, because arthrocentesis was not being done regularly and it's in so much quantity. So there was a lot of kind of mismatch about where the patient should go. Either it should go to the prosthetics or it should go to the maxillofacial department. So I had to go a lot of times to kind of tell them what I'm doing. And this is my study. And then the patient started pouring in. And then it was nice. So uh, this is not basically, that people would probably not know what you're doing. So these are the small or the big challenges that you can kind of face in your PG or in your life. Then lack of awareness amongst your peers. That is about your potential. What all you can do, how much you can manage, what you're good at, and what is your weak point. So lack of awareness in all those things happens, and these are the problems which you encounter in your daily life, in your daily post graduation life. Sorry, the word maxillofacial. When you come out and you try to describe it to people or a layman about what you do, it's a maxillofacial surgeon. They'll be like maxi-facial. People really cannot pronounce it properly. So we need to make sure that we can kind of. It's very easy for us to say head and neck, but let's not do that. Let's do maxillofacial only. Let's create awareness about the field itself. So you need to kind of uh, work on the awareness part behind just the word itself, like maxillofacial, how to spell it, how to pronounce it. Keep telling people, because this is one of the challenges that you'll face. So I mean, these are the things that should not put you down or not make you feel let down at any point, at any given point in time. Despite me saying this, despite you knowing it and feeling it, this will happen. I'm telling you. But having known this from before, you can come out of it faster and better. Now there's another big thing that happens. It's like the interdepartmental conflicts or the intra-departmental politics. Now, interdepartmental conflicts are like, with different departments, like I had said earlier, that when we are talking about a case which involves other departments and maxillofacial, if it's a major surgery. So, who gets first, who gets later? Then, about the OTs, maxillofacial. Some people think it's not important to give maxillofacial the OT because they don't have any cases. But I'm sorry, you're very mistaken. You need to give us OTs because this is our forte and we will do it. So there are a lot of interdepartmental conflicts, and believe you me, PGs do get stuck in it without your fault also, or because of your fault. Lesser of the times, you kind of get dragged into it, and it'll all come down upon you. And this is not to scare you. This is just to give you a reality that this can happen. This might happen, but that does not mean that it is something which is going on very bad, and it's like the end of the course or something like that. Not at all. You need to be aware of it, that this is natural, this will happen, this is PG. Post graduation means this is a part of post graduation, it's a challenge. Similarly, intra-departmental politics, there'll be a lot of times wherein you won't know, someone has said to do something, the other person has said to do the other thing. Now you won't know which to do, what to do, how to do, when to do. So you probably have to kind of weigh the pros and cons of everything and to try to keep everyone happy. Now that's where diplomacy comes in. Someone like me learned diplomacy the harder way through my PG. So that point in time, I was like, kind of taken aback that why I need to do learn diplomacy and stuff, because I'm a very straightforward person. I am on the face. So to kind of learn diplomacy was a big task for me, but eventually I did, and it is such a good thing. Being straightforward is also a fantastic thing. There's no doubt in that. You can get a lot of things done your way by being straightforward, and you can get a lot of things done your way by being diplomatic. So you need to kind of maintain a balance between both. But diplomacy will help you sail through much smoother than being straightforward. That's what I have seen. That's a very, very personalized opinion. Correct me if I'm wrong, please. But that's how I feel. So diplomacy, will take you kind of easily, not easy, nothing is easy. I mean, comparatively easier than being kind of upfront on the face to deal with a lot of people, because this everything revolves around dealing with people. So your communication skills, your convincing power, everything comes into play, sorry. And you'll probably know how to manage the various conflicts that are happening over small things or over big things amongst various departments, and pertaining to you or not pertaining to you, pertaining to your case which you're about to post or not pertaining to that. And then intra-departmental politics, whether it's a thesis topic, whether it's your seminar, whether it's a patient you're treating, or whether it's a case you're on the night duty for and trying to post, or managing in the emergency. There are a lot of things which are going to happen. So we need to kind of weigh our pros and cons, and we need to kind of maintain a balance between being blunt and being diplomatic in order to kind of avoid or deal with these challenges much more easier in a much more easier way. You'll be introduced to newer things which you've not probably heard of before: journal clubs, then a case presentation, or seminars. So basically, introduction to JCs and journal club is something, you'll probably learn that it's something very, very new for you. So I'll tell you another very small incident. When I happened to join my PG, and it was the first day of my post graduation, first day after I wore the formals, that is the second day exactly. So therein, there was a journal club going on, and it was about orbital reconstruction. Now, before my PG, I had never heard or never kind of thought of orbital reconstruction to be a part of maxillofacial, because, of course, the exposure wasn't as such in my UG college. And I probably also cannot think out of the box when I've just passed out. And knowing where I'm going, I had I had kind of always had an interest in onco, so it was just onco, and I could not think about anything else. So orbital reconstruction was something very, very new. And I was like, what is going on? When I was sitting in the journal, when I was sitting in the seminar hall, and the journal club was being presented by a second year resident. So I was just thinking that what is going on? So it was very new to me. So having said that, the purpose of saying this is that, there'll be a lot of new things which are coming, but then gradually, you never know when time flies, and it'll be the last day of third year, and you've been presenting journal clubs all throughout, case presentations all throughout. The art of presenting, the art of oration, the art of being confident amongst a lot of in front of all of so many people, to kind of uh, talk about things, to kind of put your viewpoint across. Then seminars on a departmental level, seminar on an interdepartmental level. Same goes for the case presentation, an interdepartmental case presentation. Then seminars in a conference. You will be introduced to going into conferences, about attending conferences, annual conferences, the state conferences, the midterm conferences, and you have to present, post, how to make a poster. And it's not just a piece of art. It's just, or putting up some pictures. It's actually about proper research about a particular topic or a subtopic, and then displaying that in the most concise manner. Then about presenting seminars, about presenting papers in conferences, how to do that, what to do. Because this is not just for PG, this is for life. You'll probably be doing this for life if you kind of are very, very academically involved as well, or clinically involved as well. So you'll be introduced to thesis writing, how to write a thesis, what is a thesis, what is a dissertation, and how to go about it, what topic you should choose. That'll be a very big challenge in its own self, that what topic do you need to choose? Something which is not performed on a day-to-day basis, or something which is performed on a day-to-day basis because you don't need to do much in it, or something which is out of the box, or something, if it is a very, very major surgery, then what will you get to do in it while doing this? How will it benefit you. So, when you've just entered into PG and when you've just entered into college, all these things you cannot think like this, like I'm telling you right now. So that's my purpose of telling you this, because you can think like that if you haven't chosen a thesis topic till now, and that is on your head, and this is something you have to do. So this is, all you should consider a lot of factors in it. You should know about what you're doing, about what you're thinking. Ask people, ask seniors, ask your parents who've been knowing about this, and ask your staff members, ask your professors. There will be short studies which you'll have to do. Library dissertation. What's library dissertation? How do you write it? And I used to ask all my staff members in my first year, sir, how do we read articles? What is an article? How do we go about article reading? Because I've never read articles till date. I've just read textbooks. What are the standard textbooks for that matter? And how do I read articles? What are the journals that I need to search upon? What's an impact factor? What's an indexing? How do I know which is an authentic paper, which is a position article? What is what? What do you mean by a study? What do you mean by a review of literature? And what are the journals of repute, standard textbooks? So you'll probably need to kind of ask and ask and ask and kind of get introduced to all of this. So, and when I'm saying all this, at one point in time, your night duties are going on. You're getting patients. You're dealing with minor patients in your initial time in the department, and you're doing that. And then on top of it, all this is coming. There are a lot of deadlines you have to meet. There are a lot of expectations that you have to meet. You have to fulfill everything on time. So that will be a very, very big challenge. But yet again, that challenge is only there so that you learn through it, and you will be able to pull it off. Trust me on that. The adventure begins now. You're going to the OR. So now, when you go to the OR, it's probably, if you haven't been there in your internship, or you haven't gotten an opportunity till now to go into the OR, it'll be the first time. Or if even if you have gone before, you'll not be going at or in a capacity as you're going right now. You're going in as a maxillofacial surgery resident. You'll probably be, if you're a third assistant today holding a suction, you'll probably be behind the knife, holding a knife in probably 2 3 years, if you're lucky, and if things go according to you. So, exposure to the OR, what's in OR, what is the armamentarium utilized in the OR, what's a flow nurse, what's a, assisting nurse, what's a assisting surgeon, what does an assisting surgeon do, the chief surgeon, the instruments, what is the Boyle's apparatus, and, what are the anesthesia requirements, how do they induce, I mean, all those things. There's a lot to learn from just going inside the OR and spending a day there, even if it's an empty OR. There's a lot to learn from that. Now, having said that, when you have your peripheral postings, now this is a very, very, complicated topic about peripheral postings. I have seen, and no offense to anyone, I have seen a lot of people who just utilize their peripheral postings to kind of bunk, or to kind of take it easy and not go there. But the peripheral posting is one of the most important parts in the journey of your post graduation. Believe me when I say that, because you'll be learning so many other things, so many other things that probably, you would have never even thought of. It's thrilling, it's fascinating to learn about so much through every department. When you're in neurosurgery, if it's a good center like ours, you'll be probably be given a chance to open up the scalp. You can be helped in kind of doing a lot of stuff in the OR, whether it's general surgery, whether it's neurosurgery, whether it's plastic surgery. When you're going to a non-surgical department, like radiation therapy, there's a lot of things that you need to learn about that. Chemo, general medicine, just a basic overview about the patient, different types of pulse, blood pressure, auscultations, percussion, everything. And it is so useful in your daily life. It is so damn useful in your daily life. And then onco, going into the onco department. If supposing, some centers are devoid of having a cleft center or a dedicated onco center. So there'll probably be a problem there. But in your peripheral postings, if you get posted there, so there's a lot to learn from those peripheral postings, because you don't know what you're interested in. You need to know about everything. So you don't know what you'll make a career out of later on in the life. So you need to see everything, you need to learn everything. So do not kind of, take it upon yourself as a very difficult challenge and you cannot live up to it. And PG is already going so hectic in my 1.5 years behind me, and then it'll also go hectic in another 1 year after this. This is a time, a free department posting where I can, kind of bunk and I can take it easy. You may take it easy to an extent, but please do not compromise on the learning aspect of it, the learning part of it, because it is equally important. Believe me on that. Then, there'll be times when everyone will not get an equal opportunity in the OR. I got to see my first condylar fracture case when I was in third year. Third year, also towards the end, whereas everyone else in my batch kind of saw the one or two cases of condylar fractures or more even uh, during other times, whether as a second year resident or a first year, just going into the OR, or during third year sometime. I got to see two condylar fractures only, and that was just towards the end of the. So everyone might not get an equal opportunity to kind of see all kinds of cases. But again, that is not a very very sad point. That is not a very very depressing point. It'll take a lot of time for you to kind of become a fantastic surgeon. Believe me. So there's a lot of time after PG to learn as well. It is not that whatever is said and done during the PG is that's that. No, you can get to learn a lot of other things after your post graduation as well. Dealing with certain things in very critical times about untoward loss of life. That's an emotional challenge which a lot of people might feel differently about, not having expected certain things. And it might happen in your department or rarely, or in other peripheral postings when you're posted and to the chief PG there, uh, I mean the main PG there. And so that could be there. So you need to kind of be strong enough and brave enough to face that, and it should not be as if it's a breakdown for you. Coming on to the special subspecialty part, this is also a very very big point in the lack of awareness amongst you yourself. Also, as a first year PG, we won't know what all the entire plethora of maxillofacial surgery, what all it entails. So all these things, onco, aesthetics, orthognathic, cleft, craniofacial, TMJ, minors, and trauma, everything which the maxillofacial specialty entails. It's a very very what do we say, overlapping field between all the other different departments, where there'll be interdepartmental conflicts. Like I said, when it comes to onco, it'll be an ENT conflict. When it comes to trauma, it'll be a plastics or trauma or aesthetics or orthognatics or clefts, craniofacial. All this, it'll be a this thing problem or an overlapping thing with general surgery or the plastic surgery. So those things are kind of have to be managed, and those things should not be taken in a very very negative way. It should be dealt upon properly. It should be dealt upon positively, and you should learn from everyone. In your PG, just remember you need to learn from everyone, and you'll get on with your PG very nicely. And this awareness is to be created amongst you yourself and amongst the people you talk to, whether it's different department people or whether it is uh, people in your day-to-day life besides the college. There'll be institution challenges which could be professional or personal. Like I said, there'll be demographic challenges. Probably if you're supposing in north or probably south, east, west, there'll be certain types of cases which are coming in a certain particular kind of a place. So a lot of clefts, a lot of orthognathics, they come down south, which happens. It's slightly comparatively on a lesser number when it comes north. So you'll probably feel that there are not all types of cases where I am studying, but that's okay. Like I said, it's just the beginning of your learning curve. PG is going to end, and then you will also learn a lot after that. There's a lot of time to learn. Quality and quantity matters. Even if you get one patient to see properly, just see that one patient very nicely and know about it, read about it, go to the OT. The challenges from here will come to here. There might be times where you won't get any hands on, or you feel that this case I wanted to do, or I wanted to do some part of it, and you won't get it. It's okay. That's a challenge that you'll probably, once you come out of your PG, you'll probably think of it as a challenge to do it then. So challenges again are not limited to just PG. They're limited after PG as well. They can be continuous or they can be stopped and then rebuilt. And you can capitalize upon that then. And you are in a better position to kind of deal with them when you've actually faced it once in your life. Peripherals can be limited, but then yet again, even if they're limited, you kind of have to deal with it properly. Just request your staff, just request your professors to kind of uh, let you get accustomed to and let you get exposed to a lot of other cases, a lot of other types of surgeries which happen. Then there are a lot of personal problems which might happen. This was all just professional, what I was talking about till now. A lot of personal problems which might happen. If you're going to a different place, there could be a communication gap, there could be a language barrier, you could different, I mean, problems in acclimatization to a place, or the food, the surroundings, you're not used to anything, and your family support, if you're away from your family, will be less, and all the personal things which are there. And so all these things combined together will kind of also add on to some amount of stress. We do not deny that. I do not deny that stress is a very important part of this. So challenges will lead you to stress, most of them. Now it's upon you and the mindset whether you want to convert that stress into something bad or work upon it, capitalize upon it, and make it something very good and develop upon yourself. So resorting to recreational drugs or alcohol, that happens during PG. I won't deny that, I won't lie upon that. But it should not affect your mindset. It should not kind of affect it so badly that you get very frustrated and sad about it. No, because this is part and parcel of post graduation. It'll be there, but it'll go. Even your personal problems, your personal equation with people, be it your colleagues or anyone else, if it's bad, it'll go off. If it's good, work upon it, make it through life. Honestly, it's very important. There'll be a lot of politics. Some people might feel a little financial constraints in a lot of things. Everything will work upon, everything will come out very nicely. So even if that's there, I know it's very easy to be saying it and difficult to be kind of actually going through it. And but I've been through it, and that's why I'm on the other side of the table and telling all this, that it can kind of be dealt with in a very mature way, in a very decent and a strong way, and you can come out as a winner from that. Then there are probably some unexpected challenges, like it can happen, like it happened right now, like a like the COVID-19. So like there's some things you cannot do just any you just cannot do anything about. It's not in your hands. But what you need to do is just have that frame of mind in a very positive environment, and think of it as a glass half full, not half empty. And you've just got and you've got a lot of time to learn, believe me when I say that. Maybe this could help, being shown the roadmap at the beginning of your course, an academic calendar with some tentative deadlines. Even if you're not told about that, I mean, if someone doesn't tell you, just if you have all this in your mind, make a chart, keep it there, it'll help you deal with it. Acclimatization, what a JC is, what a case presentation is, what a seminar is, how it is to be presented. Take notes of when your seniors are doing it and build upon that. Make your first seminar, first JC, and first case presentation in such an amazing way that people are just applauding you, that oh my god, this is a very good thing that you've done. Honestly, the first one should be very nice. And time management, all of them should be nice, but first one should be very nice. That's what I meant. And time management, of course, it kind of it should not pile up upon workload, because that will again add to a lot of stress. And like I said, diplomacy, but maybe to an extent only. You need to constantly read. The importance of basic sciences we do not know. The other people from different departments would also not hold basic sciences in such high regard and and of such an importance. But you need to know about, because it is really important in your life, in your subject, in your field of practice. Trust me on that. And you need to constantly read about it, constantly read about other articles, other topics, the latest advancements. So all of this, I know it's a lot to take with the department, with the duties, with the personal life, and with all this, studying as well and keeping everything up to knowledge, up to date, keeping your knowledge up to date. It's a lot to take, but yet again, it has to be done. It's your post graduation. It'll go off just 3 years, and but after that, you would have learned all of this. And post graduation is a wonderful period. Believe me when I say that, it's an amazing period. It's a journey of a lifetime. You'll grow so much through it. You'll learn so much through it. Work life balance, and whenever possible, get into teamwork, because teamwork is very, very important, whether it's with your one of your batchmates or with two of your batchmates, or with a staff member or with a professor. Just get in teamwork. That's really helpful. Remember, not all good teachers are good surgeons, and not all good surgeons are good teachers, but you should learn from everyone and learn by seeing. Like they say, a lot can happen over a case. Just remember that. And passion is more than enough to guide you through, because it's your passion that has got you here. It's your hard work that has got you here, and passion is enough to guide you through. Thank you very much for the patient listening, and have a good day. Thank you.